Hello everyone, welcome back to my channel, and again thank you for all who are watching and learning from my videos, and hope you find them useful. And those who's just seen this for the first time, I'm doing these vlogs to help um, upcoming physiotherapists, especially who are international trained and wanted to have a career, start a career here in the UK, right? Um, I was just reading from the comments in my channel, and again, thank you very much for watching and giving those suggestions. And so I'm answering one of the suggestions there, which is to give you some respiratory questions, okay? So I'm just browsing on my notes here, just to reiterate that um, it is a good point for you to practice a systematic way of answering. Okay, so let your interviewer know what you're thinking, and so explain them what's the scenario, explain what you're thinking, what's your intervention, and what's your expected outcome, and what will be your progression or update on that. Okay. First question. um, for example, you see a patient who is short of breath and the O2 sats are dropping, and the patient is query pulmonary embolism. There is suctioning equipment and everything else ready for you. What would your assessment and treatment be? So that's my first question. Next question. You are asked to use IPPB to a patient after cardiac surgery. I hope you know what is IPPB. The consultant has requested at least twice a day. However, the patient is mobilizing independently and doing stairs twice a day. What would you do? Next, prioritizing. I think this is already a very common question for all of you. How would you prioritize this group of patients? Day 1 post-op laparotomy, a respiratory patient, a new mobility referral, a discharge, and a patient known to you who needs increasing assistance to mobilize. Next question. You have a new patient with a total hip replacement on your ward. They are very worried about moving the leg and getting out of bed. How would you approach this patient to begin rehabilitation? Next is sort of a practical question. How would you interpret an X-ray? Next question. You are called to see a gentleman with bronchiectasis and a new chest infection. He is struggling with secretions and is becoming increasingly drowsy. Furthermore, he has not expectorated for the last few hours. His saturations were 96 but have now dropped to 84 on 11 liters of oxygen. What would your treatment plan be? Next, given patient info on ICU, PEEP 10, PS 15, SATS 83 on 60 O2, on auscultation reduced breath sounds on left and absent in bass, ABGs pH 7.29, PaO2 is 8, PCO2 is 8, HCO3 is 22, and BE minus 2. What do you think the problem is? What would your treatment be? Next, Can you talk about any COPD guidelines you know and how this impact your practice? Okay, so those are my respiratory questions. Hope that you got them right and have a read on how to answer them. In case you wanted the answers, sorry, this will be available for those who are availing the mentoring scheme with CSP. In case you're a CSP member, check the CSP's mentoring scheme and look for my name, and maybe we can work together. Okay, for those of you who's watching my videos, if you want me to post anything in my videos, please comment on the comments below, and see you on my next video. Thank you for watching.